Okay, this is a scar condition. In 5 months, you can see.
Hello everyone, I'm a patient at Height Increase Info, and today I have Dr. Hirdesh here with me. He'll be conducting the interview.
So this is new beginning. He started. So today we are here with new success story. So he will explain his whole journey. He lengthened 6 centimeter in tibia, bilateral tibia lengthening successfully, and now he is walking with Ed with crutches. So we will know about his journey. How was the process?
I came here, my target initially was 7 centimeters. I wanted to increase my height so as to gain more confidence in myself, to be better at what I do, to be better in my career, etc. But in the process, while lengthening, I realized that my legs are getting a bit stiffer. So I decided to stop at 6 centimeters. And also when I stood, so after 4-5 centimeters, sir suggested me that I started standing and walking. When I stood after 5 centimeters, I thought that this is just a fine height for me. I don't need to get any more than this. Also, at the back of my head, it is that I might go for another surgery for my femur lengthening after a couple of years when I've recovered from this. So yeah, I just stopped it at 6 centimeters.
Yeah, best listened his body reaction. So he stopped at 6. He want to do 7 centimeter. When he came here, he want to do 7 centimeter at least. This is good thing he stopped at 6 centimeter. Now his condition is much better. So that's why we said always just listen to your body and don't go beyond over limit. And how was pain during the lengthening? And what is the difference during lengthening phase in frame and just after frame removal?
Luckily for me, I didn't have much pain during the lengthening time. By God's grace. Other patients did a bit, but I didn't face as much. After the removal, that is another case. See, after the removal, they need to stretch your legs. They need to loosen your muscles. So for that, you have to do intensive stretching and physiotherapy. That was a bit more painful for me, the stretching part.
Stretching pain, just only the exercises on this exercise time.
Yes, just the stretching pain. When you stretch your legs, you extend them to your full range of motion. That was the only discomfortable part for me. Otherwise, it has been very peaceful rather than.
How you manage daily activity in frame?
In frames, we have caretakers with us. They'll help you go to the washroom, they'll help you wash your hair, they'll help you wash your face even. Whatever help you required, you just have to give them a call 24/7. They'll come at your disposal and they'll help you. After the frame removal, it has become obviously a bit more easier. I can use crutches, I can use walker, I can also use the chair, which I used in the lengthening period.
You want to give any suggestion who want to do in future limb lengthening, who want to do limb lengthening? So any advice for them?
The biggest advice I can give you is that first of all, listen to your own body. Also listen to the professional who is with you. If they are suggesting that you shouldn't go for much more than it is required, if your body is not allowing it, then you should actually stop at that point, because at the end when you have increased your height, you have to walk, you have to live a normal life. There's no point in increasing and then getting bedridden the whole time. So that is my biggest advice. Also, educate yourself more on this topic. If you know about your muscles, if you know about your tendons and the bones which are being operated, this will help you a lot in the process.
Yeah, very well said. So before surgery, acknowledge yourself, educate yourself about this procedure, because this is not a one-day procedure. This will take time. So you should know about it first and then go into the process. So you want to say anything about the height increase info, full height increase info team?
The main reason for which I came here was that they have a whole package, they have a whole team working at your disposal. Otherwise, you have to arrange for yourself, which is quite hard, and also you're operated, you're in frame, so it is not at all easy, it's not at all comfortable. So Height Increase Info has provided me with that ease and that conditioning, which helped me ease my process of lengthening. And yeah, so I have had a pretty good experience here, and I will suggest this place to the other wishful patients.
So are you happy?
Yeah, I'm quite happy with the experience here. I just have a slight bit of tightness still, which sir has suggested me will go away with the walking and stretching. So yeah, apart from that, everything is just fine. Also, I would like to say that this whole procedure of lengthening and then coming to your normal walk and to your daily activities, this is all a patience game. You have to realize that it is more of a psychological thing rather than the physical physical one. If you are psychologically strong, if you are mentally stable, sound, then you will ease up with the process. But it's not much physical pain, then it's the psychological one. Also, so for me that this is my 5th month and I will be leaving to my home using crutches. After a couple of days or maybe a month or two, I'll be able to walk on my own with my feet, because currently I have slight bit of tightness, as I said. See, again, it has already been 5 months and I'm still in the process, and after this also I'll be in the process, because just the procedure has ended doesn't mean you have to stop your stretching, you have to stop your daily routines of exercises. You have to keep on with the routine. So yes, it's a time game, and as it is said here that pain is temporary and result is permanent.
You need patience with this procedure if you are going into this procedure.
Where the nail inserted, same place, both leg. Osteotomy place, it's almost gone. Pin cutting, these are screws mark, lower screw mark, and these are lower pin. These are the scar condition. Maybe after some time and after few of months, it will go away itself.